Thank you, Cindy Hall, for that wonderful, lovely introduction. Um, Cindy has been a gift and is a gift to my life and also the life of our community. Um, One of the areas that I just enjoy about Cindy is you pose a question or a request and she acts on it. And so the last time we were together, my question was about Mother's Day. And I said, I want something meaningful for Mother's Day. And so you see these beautiful beads that I'm wearing? Well, Cindy showed up with a bag full of them. So why am I saying this at this point in recognizing the great work that Cindy's doing? Because there is a legacy here. These beads are a part of a project that's funding education. Is it Uganda? That is a part of her daughter and her daughter's husband's legacy. And that's what we're talking about today in community engagement. You have a solution, you have assets, and you pass it forward. Thank you. Mother's Day is a wonderful day for me. I want to also acknowledge my beloved husband, Larry. This work has always been a teamwork, and that teamwork has made it a dream work, even when some of it appeared like a nightmare. Not because of us, because we love each other unconditionally, but when you live in a community that is rated the highest in having social determinants. 72 in Milwaukee County, right? Is 71, and our area of 2,700 households is the highest in the city. So when we talk about the challenges that we face, and we don't face them from the outside, we live by choice in this community. So our neighbors are neighbors that we love, that challenge us every day, and that inform us. If you would listen to some of this, you will already know that I don't need to speak much longer. This is the way that we move, and this is why there are changes. So I am delighted to be with you on your journey of community engagement for health and healing. And I will present a very brief framework. There's a wonderful timekeeper who will say, because that opens the gate for us to have a conversation. And I understand that this conversation is with those of us in this room, but the opportunity for a larger community to join it. And I am honored and privileged by that. So it's to present a framework for community engagement, share my community's journey to improve the health and wellness of residents, and to offer a few ideas that might strengthen community engagement in the Department of Family Medicine. And let me just say, as I talk about the Department of Family Medicine, you're doing so much already. You're not starting from a sum zero. So it's a question about how do you do more, what more do you do, and a few ideas from me that you'll find value in or not, and that's okay. And I look forward to our conversation. I had the pleasure of visiting the Blue Sky Strategic Planning website, and your process in your community, your campus community, is such one of engagement and principles and practices that are ours also. And there are 5 that I would like to stress and leave with you as you go forward. And let's see if they resemble what you've experienced. Your community, I understand, is about 1,000 or so. Our community is 2,700 households, about 13,000 people. So we got some lessons that we can share. Here's number 1. Expect to expend lots of energy to engage colleagues in a change process. Does that sound familiar? And yes, sometimes it involves raffles and incentives, uh, but it's okay. Expect that. A change process means you're building momentum, a new direction, an expanded direction. So expect to expend lots and lots of energy to engage your colleagues and neighbors. The second one is to give voice to as many individuals as possible. You never know where that next best idea is coming from. From us, it has been sometimes a child who says, I want to go to the library. And Larry will say, you can go to the library when you write your first and last name. And his family tells us he will not write his first and last name. And the little boy says, I want to go to the library. And we learn that if you give an incentive that matters, he wrote his first and last name, and he went to the library. Those fishing for ideas, give as much voice as possible to as many people as possible. Does that sound familiar? I watched your survey count. Wow, you had an ambitious goal. Yeah, I'm very nosy. I looked at it. You had an ambitious goal of getting 700 people. The last I counted, it was 354. But in that, cultivate it, because there's a voice screaming out that is a good idea. Develop a vision and pathways where resources are attracted for implementation. One of the early on lessons that we learned, puzzled about what had happened to this beloved community that I grew up in, was that we lost our vision. And that collective we was government, corporations, medical institutions that moved out of our community. There were 3 hospitals that I knew of that relocated to better grounds for them. They lost a vision of what it means to take resources out of community. And so when I moved back in, and everything I found and everything Larry found was about crime and violence and unemployment, you keep peeling that back, it's about isolation. And so we had to create a vision like you are doing with Blue Sky Strategic Planning, and we have done with Blue Sky's programming. And if time allots, I'll talk to you about that. And if it doesn't, ask a question about Blue Sky's programming. And then the vision is only as good as the pathways with resources. We live in such an abundant community, and yet we get comfortable with poverty? No way. No way. I learned that these beads that I am wearing represent 40 scholarships. Come on. We can do this. We have to be intentional about resources. We have to be generous. We need to share. But develop pathways that encompass and include the populations that you are dedicated to serving, but includes them as members, not as charity. The fourth one is to nurture relationships. We had a colleague that when we would get in a tough spot, he would say, "Go team." And we'd say, "Okay." But team to him meant together everyone achieves more. And so some of us have grown up, even in, I know this sounds odd to you, but even in medical training, that is so competitive that we forget that a team can achieve more. I grew up with training in social work. So social work appears to be group work, but we become so competitive in this process that sometimes we forget about the team and that we are all valued members of that team. And my fifth one is one that I love, and that we hold ourselves accountable to the outcomes. It's not about just saying what we're going to do. It's about doing it. It's about sharing the success. Larry teaches, and he always teaches with his hands open. That means the information is for others. I love the visibility and the transparency of your blue sky strategic planning process. I encourage you to stay that transparent. Now, sometimes, I don't know about you, but sometimes there have been things that we've tried that have not worked. Am I the only one? Well, you know, that might be the best lesson that we can pass on to someone else. We tried it. We tried it under rigorous conditions, and it didn't work. And it's those painful moments when we have tried and poured our soul and our work, and it didn't quite hit the mark. Doesn't mean we quit, but we need to go back and reevaluate and call in the team and find out what has happened. So those are the 5 principles that guide our community engagement. And I hope that most of them are very familiar to you, because when I looked at the blue sky strategic planning process, although you didn't align them in those particular words, I could find them there. Expect to expend a lot of energy. Give voice to every individual. Develop a vision and pathways where resources are attached for implementation. In other words, don't run away from doing what you know is right because the money doesn't seem to be there. Did you hear me? Don't run away from what you know is the right thing to do because the money isn't there. Open the door. Get the money. Nurture leadership and hold ourselves accountable. So I wonder how Walnut Way became increasingly engaged in health and wellness. That's not really where we started. Walnut Way's mission is to create and sustain an economically diverse communities, and our strategy is focused on civic engagement, environmental stewardship, and creating venues of prosperity. In 2008, we engaged a quality of life planning process that included a 110-block area with what I mentioned was 2,700 households. Did all of them attend? No, but we covered every quadrant. The rooms were filled. People had lots to say. We did, and a lot of times people don't show up, but you go to their door and you knock. And we did. So we bunkered down, and we involved colleagues and neighbors, and 8 strategies emerged. Most were not surprising, right? If you live in a community, you want public safety, good schools, vibrant commercial corridors, quality housing, services for youth and families. However, 2 strategies that emerged surprised us, and we didn't know what to do with them. Exactly. One was quality foods. People wanted good nutrition. You've heard the term food desert. You know, it's a term, but unless you live in a community where you have to take 3 buses to get good food, it becomes very real. Then you have somebody like Larry and his team that decides to take old vacant lots and turn them into high production gardens. And yesterday I had the best collards out of the garden. Yes, I'm telling our business. And these collards are growing, and there are no fences around it, and people are eating well. And so we have some ambitions now around good nutrition, because nutrition is tied to culture. And when we started this in 2008, we used what was culturally relevant to spur our nutrition. So there's a lot of stories about nutrition and foods. And again, if my time runs out, you could ask me a question. But the other big one that we didn't expect was health and wellness. It showed up. It was a demand. No matter how I tried to shake it off, I thought 7 strategies were more than enough. How could we do this? And I have 5 minutes. But we could not overlook the statistics. That's why being data-driven is important. That's why Cindy Hawk and her team, they're important. They feed us with data. And what we might think is an isolated incident, there have been 10 premature deaths on the block we live in, from babies born and not living for a year, from violent deaths in our own gardens, from a man going to sleep and not waking up because he didn't have the attention to his cardiac condition, from a 12-year-old going to sleep and not waking up because she didn't have the attention to her asthmatic conditions. We felt this in an isolated block situation, but the data said this is what our neighbors are experiencing. And most of them have in common poverty and a lack of access to meaningful health care. So quickly, I want to tell you or share with you what our community health vision means. It means that there are individuals and collective groups that embrace knowledge and practices for living healthy lives. Health and wellness services are available and valued. Connections between healthcare providers, community agencies, individuals are authentic and transparent and often occur in community. Data is an active tool in setting directions, and plans are designed and implemented in partnership. We have 20 active partners that include most of our healthcare providers now. And in my last 3 minutes, I would like to focus on what idea are you already stirring that we would embrace and welcome so greatly to our community. One is a pipeline. I would love to be able to come here in 6 years and see a diverse population and see that that population represents some of the people that live in our community. If we can make beads that give scholarship, can we not find a way of providing scholarship for people that want to go to a medical training? You're a marvelous, strong teaching institution. Think about it. And there are different ways of pipeline. I love when Triumph marches in and they provide hope and vision. A summer placement would be phenomenal, And then we're building this place, which we call the Wellness Commons. What would it mean for your school to be involved in that commons with students and faculty? I know what it would mean for us. It would mean that our relationships are authentic, that people see it, and they see a pathway. You're already doing so much of this as a big place. There's Rush, right? Rural and urban scholars. You're already doing it. There is Triumph, and there is a need and an opportunity to come to community. So pipeline, and then I want to mention the 3 I mentioned that 3 hospitals moved out, but one stayed, and that was Aurora. And you have incredibly wonderful relationships with Aurora. And that's the health care. And I think we have an opportunity. I think there's an opportunity for more money to come in and help support our work in partnership with health institutions. But I leave that for you to think about. I am now serving on Aurora Sinai's advisory group. And the energy is so good there now, of moving away from an emergency center to a place that provides health care, a place that is absolutely attuned to family medicine, a little puzzled about some of the steps, but not puzzled at all about the commitment and the infrastructure that's needed. My last comment is more or less based upon a self-check that I did today. So I'm thinking, okay, I'm going to get up and say this. Are we really doing this in Walnut Way? So I went to the website, right, last night. And so what you see are the banners that go around and around. And this is our health and wellness. I'm going to speak fast because they move fast. We had a murder in our gardens, and we turned that into a peace project to heal. We have classes and events where women come together and men to create networks and social healing. There's that Blue Skies landscaping crew. Do you know some of them are making prevailing wages? Woohoo! So I thought, okay, it is evident in these 4 banners that health and wellness, that definition that I gave you before, is real in our community. Then I'm going to, I hope, move to meet our new health coach. Click, click. Who would have thought that Walnut Way was going to employ a health coach? See what it means, that principle of live your mission? And I didn't know it was on our website. So I was delighted with this discovery. And I want you to know that she is of community, well-trained. And I just love how she speaks. Let me leave. I can't leave the mic because I'm not tagged up. So you can read it. And she believes this, and she's coaching us, and she's connected, and she's trained. And so I said, okay, Walnut Way is moving into its direction and is living there. So I'm going to close now, and I'm going to be open to your comments.